Hello and welcome to the March edition of the Kushmerek Connection, filming today at FATV Studios, now located on Boulder Drive in downtown Fitchburg. Joining me in studio today is Brandon Robbins, Executive Director of Ginny's Helping Hand, and Sue Christensen from the City of Fitchburg, who's the, I'm going to mess this up, Sue, the Intervention and Crisis Coordinator?
Outreach and Prevention.
All right,
Close.
There we go. I told her in advance I would mess this up, and sure enough, I did. Welcome. Thank you both for joining me in studio today. I'm going to start with you, Brandon. No stranger to the Kushmerek Connection, but also no stranger to Ginny's Helping Hand. Tell us a little bit about yourself and how you found yourself in your current role.
Yeah, absolutely. Thanks so much for having me on today. It's nice to be on set with you instead of behind the scenes, which is what I'm used to. Talking a little bit about my history with Ginny's, I started with Ginny's when I was in high school as a volunteer there under the former executive director, Sue Zephyr. And I really found a liking for the work. So when I went to college, I studied political science and continued working at Ginny's during that time. Really enjoyed the politics, obviously worked in your office for almost 2 years as your legislative aide.
And you survived being producer of the show as well.
I did survive. I did survive. I'm glad to pass the reins on to Rebecca, though. She seems very happy with the role. And then this opportunity came when Sue decided she was going to step back from the role as executive director, and I've stepped into the role ever since April of last year. Fantastic.
And Sue, you've been with the city of Fitchburg in several capacities, and really working on the front lines of homelessness and substance abuse. Tell us a little bit about yourself and how you found yourself in your current role.
Well, I started actually in the legal profession many years ago. When I returned to work after having children, worked up at a hospital in an emergency room, basically connecting folks with substance abuse and homeless issues to services. It was run out of a program out of Boston Medical Center. I then went to work for the Montechusett Public Health Network, which is overseen by the City of Fitchburg, doing prevention work.
Sure.
We had several prevention grants that we oversaw, Mayor DiNatale made a position of substance use prevention several years ago, which I continued in doing the role for the city directly. Recognizing the need for some homeless outreach, we've, since last April, have been working on homelessness initiatives as well as prevention work.
Sue, if I remember correctly, you have a background as an attorney as well, correct? Yeah.
Yes.
At what point did you realize that this was really your passion and the area that you most wanted to focus your career on?
I think working, actually, I did a lot of appointed counsel work. Seeing a lot of the same people cycle through the system based on substance use and mental health issues, really felt I could have more of an effect advocacy-wise, helping them at that level rather than, represent them. Nothing changed. So trying to intervene at that level and try to make change in that positive way.
And Brandon, for you, at what point did you figure out in your early career that, providing help and assistance to those most in need in our community was something you were passionate about?
Yeah, I would say for me that it came pretty early on. When I got the first experience of learning what it was like to have an impact on somebody else's life, working and volunteering at Ginny's, I realized, ooh, this might be something I was interested in. The reason I decided to study political science was because I see politics as a mechanism of being able to do that if it's used appropriately. I bet a lot of people can see, looking more on the national level, why some would think that it's not able to be used as that kind of tool. But the work you do, the work that's done on the local level, I think really makes that positive impact. Working in your office for 2 years, I got to do that with constituent services, my favorite part of the job. And then working back at Ginny's, being on the front lines again, I get to do that every single day and make a real impact on people's lives.
Well, the reason I asked you two to be on the show both together and initially we're each going to do our 15-minute segment with each of you, and it's really this thought of all too often it's perceived that there's this breakdown between our nonprofit community and government. And what I've seen through my role is often that it's quite the opposite. It's the two working in tandem, our nonprofit community and advocates working hand in hand with city, state, and federal government at every level to really help make sure that nobody gets left behind here. And so I thought it was important to bring folks on because often, homelessness and substance use and mental health are inextricably linked. Not always, but sometimes are, right? And the entry point to service and to help could come from either or both. You might make a referral to our nonprofit community and vice versa. Mm-hmm. So we'll start with you, Sue, of how do you often, the first time you're getting acquainted with an individual who needs help or service, the first time whether they raise their hand or they're asked to raise their hand and ask for help and service, how do you interface with them, and then how do you interface with our nonprofit providers?
Well, we're very fortunate. We have 2 contracted employees working with us as street outreach workers.
Sure.
Keith Barnaby and Kim French, who are in the streets daily. They're in the office less than an hour a day just to check in. They're out checking up on folks, connecting them to services, and not just connecting them, but bringing them. If they need assistance with something, they'll walk them over to that agency, introduce them, make it...
Literally walk them over.
Literally,
too, right?
literally.
Yeah.
And that handoff is a wonderful way to build on the trust they have with Kim and Keith, and in turn, because it's scary to go into many governmental agencies or an agency you haven't been to before. So that's a real big part of that. And what we do is, a lot of times we do get calls from our street outreach phone. We get referrals from agencies, whether it be your office, Senator Cronin, police department, fire department, mayor's office. We handle calls from a variety of different areas and really try to find the best resource for that person. We're not case managers. Our job is to connect people to the resources that can help them and guide them along that way and hold their hand as they get there. And we've had a lot of success working with our local community agencies. We have a Fitchburg interagency team that meets twice a month, which consists of all agencies and also city departments who are addressing the needs of the homeless. And that has been a wonderful way to build the community of referrals and build. A lot of friendships have come out of it, and also a lot of strong partnerships. So we're very proud of that.
And success stories along the way,
yes.
too, I have no doubt. Right. And Brandon, for you, when you see people at the entry point of asking for help, whether it be for homelessness or food insecurity, what does that look like, and how do they often end up at Ginny's Helping Hand?
Yeah, I think our interaction is a little bit different than Sue's interaction. Sue, Keith, and Kim are really out on the street in the community. We're a little bit a step further in that, right? A lot of the people that we're seeing are the people who are raising their hands saying, hey, I need some help, and how can you help me? So it's usually people coming in to take advantage of our food pantry. They come in, or can come in twice a month. There's really no restriction on where you live, what you look like, anything like that. We're there to help people. And it's really important that we do. Since the start of the pandemic, we've seen our numbers skyrocket through the roof. That, attached with the kind of uncertain economic situation of today, has really pushed up the need in our region. It's funny that you should ask about the relationship piece, because Sue and I, as we were waiting to come on with you, were talking about just how important that is. The work that we both do as a governmental agency, as a nonprofit agency, is so important, and the only way that we feel that we can do it effectively, I don't mean to speak for you, Sue, but is through that partnership and the relationships that we create. I don't have all the answers. She doesn't have all the answers. No one agency, I think, can do it alone, but when we work together, that's really how we meet the needs of the people in our community.
So I think often when folks enter, whether it's through the nonprofit system or asking for help from government at any level, it's often, I take it personally, I look at that is every other lane or avenue of government has failed these folks to this point. And often it isn't in the first year immediately preceding the help. It could be for decades. It could be generational level trauma or the inability of government to effectively intervene in this person's life to keep them off the streets, to keep them or their children from being hungry and then being forced to, to arrive at a food pantry or to seek, SNAP benefits or anything else. So I look at that as, somewhere along the line, we have failed to create the right conditions for people to thrive and to flourish. And we've lost a lot of their trust up until that point of government. How important is it when they do raise their hand? The first time that we might have a chance at winning their trust back, because everybody else has failed them to that point. How important is it for each of you when you do interface with folks? Is it at making sure that you get it right? Sue, we'll start with you.
Oh, it's absolutely crucial because oftentimes, you're right, people have been failed many, many times over the years, resulting in whatever condition they're in. And we really pride ourselves on when someone is looking for help, we're there for them. Kim and Keith go out, as I said, daily. They're building that relationship of trust with folks in the community. So, many times, even if there's a need for a change, we can't make anyone change what they're doing. But when they're ready, they know that we'll help them, and we're there, and they trust us. And that goes a long way. That goes a real long way.
Yeah, just as much as the relationship between us is important, the relationship that each of us have with the people that we serve is important. And I think that's why it's so critical that when somebody comes to us and says, hey, look, I need some help, that we're not only welcoming, that we're not only trying to do everything that we can to get them the services they need, but it's important that we're working together as well. Because if I can't do it and I shut the door and say, look, I don't do what you need help with, and I don't know who to refer you to, they're never going to ask for help again. And I just think that does a total disservice to the people in need in our community. We need to be ready to serve people and get them to where they need to go when they need the help, because there's a lot of pride that goes into that as well. I think all three of us know that when somebody raises their hand and says, I need help, it was probably 3 or 4 weeks of contemplating whether to say, hey, I need this help. And it shouldn't be that way, but the point you make about, having been, disappointed and turned down so many times to get to the point of asking for help, we've got to recognize that we need to get them where they need to go as soon as possible.
I talk often about, my own lived experience of, I grew up going to food pantries with my parents and receiving food stamps at the time and now SNAP benefits. And it was something that I was told at home, you don't talk about those things. When my father was homeless later on, towards the end of his life, you don't talk about those things. You don't air out your dirty laundry. And because you don't want to tell people that you need help. And I think hopefully that stigma has changed. And I'll admit, it took me a long time to admit, yes, we received help, and it's not something you should be embarrassed about. And everybody and every family needs help at some time or another, and everybody starts at a different starting point. And so I think it's so crucial that to your point, when they do raise their hand, that we nail that opportunity, because it takes a lot. It's not easy to raise your hand and ask for help and say you can't do it yourself. So when you do, you need to make sure that you're meeting people where they are and providing the help that they say that they need, not the help that you think that they need. I guess shifting just a little bit, I think there's this perception of what homelessness is, right? Chronic homelessness is that, folks are on the streets and they'll always be on the streets, and they haven't, they don't want help, they don't need help, and they won't accept it. I know that's not true, because we often work with you. We get to hear the success stories. Take us through, out of the the homeless population that you work with, Sue, can you talk to us a little bit about some of the success stories of people who have been chronically homeless, and you've been able to effectuate that change and get them off the streets and into long-term housing?
Yes, we've actually had several in the last few months. And again, I think to what Brandon said and what you said, it's really treating people with dignity and respect. And what do they want to do? And when they're ready to make that change, we can help with that. We work closely with the Community Justice Support Center of the Sheriff's Office, helping folks get IDs. When you're living outside, you don't need an ID, you often don't have one, but that can help you get into a motel if it's cold, to get into treatment. You really need an ID for a lot of things.
Access to insurance,
as you
you name
move
it,
into
right?
society. So Kim and Keith work tirelessly all summer to work with folks to get them IDs. And that's just one piece of it. We also have a subcontract with Restoration Recovery here in Fitchburg, where they are plugged into the continuum of care out of Worcester, where we can bring folks up, walk them through the application process, and they're on the list, they get into housing. We've had several get into housing that way. But while they're there, we're also looking at what else do you need for support? Do you need some other benefits? Do you need recovery support? Do you need any type of support they need? We're there to find, if we can't do it, we find the right person to plug you into. Do you need medical, dental, or behavioral health services? Here's Action Health Center. Bring them down there and get them plugged into that. So it really is a community and truly a village of people that working together to make sure that everyone's needs are met.
And Brandon, I guess, along the same lines of, you might often see people at the point before they become chronically homeless, the first time they raise their hand and talking about, stopping that trend before it really starts. Talk to us a little bit about not only the services that Ginny's provides for folks for homelessness, but also, how you then make those referrals to make sure that it doesn't continue down that path.
Yeah, so you're definitely right. We do see people, that are on the cusp, that are kind of working in that direction. And I have a great staff who is familiar with the resources that are in our region so that we can connect them ahead of time with the services that they need. Whether that's getting them, connected to our CAP so we can make sure that, if they've got rent issues that we can take care of them, getting them connected with somebody who's providing assistance with utilities or heat, so that way they can have that taken off their plate. It's really important that, like we've talked about numerous times, that we provide that assistance when they need it and when they're asking for that help so we don't miss that opportunity.
Well, I think we've said it time and time, it's so critical you can meet them where they are. And getting people to really open up and earn that trust. Sue, out of the large, out of the homeless population in our region, are they almost always, are folks almost always interfacing through Keith and Kim on the street level, or are there times where folks are actually calling and saying, "Hey, I'm ready"?
We've had several that have called, maybe referred from someone else.
Sure.
That are either about to be homeless or are homeless. And that's, just another way, or someone calls your office or City Hall. We can try to plug in, as Brandon said, let's get you into these services now. Someone's about to lose their apartment. How can we connect them to the proper services to get them the help that maybe they can stay there? And that will keep them from becoming homeless, unsheltered, and starting at another whole level of intervention.
And it's, I think people often have that same idea of, what everybody or may have their own idea rather of what homelessness is or how it starts or what it looks like. And, we often hear those heartbreaking stories of, someone was working a middle-class job. They were able to pay a middle-class rent. And through a no-fault eviction, or maybe the landlord selling or something happens to the shelter for one reason or another, they're then rapidly trying to find housing in a 30-day period of how do I get a new apartment? And I think, as we all know right now, with the housing and rental market is what it is, you could be looking for an apartment for 6 months and still have some real difficulty finding something anywhere remotely close to where you are. And so I think we often hear folks who are, they're working at it every day, almost like a full-time job of just trying to find housing. And they're in their last few days of, I'm homeless in 3 days. And it really starts to dawn on them of, I have no other option here. And you hear the heartbreaking stories of folks who say, all right, I'll put my stuff in storage, I'll find something in the next week, or I'll stay in a hotel for a little bit, and then when they start running out of money, I'll sleep in my car for a couple of nights just as a bridge until I find that. And then the battery dies. And the next thing you know, you hear these stories of, they're in a parking lot in a car that doesn't work. They're losing their job because they don't have access to showers and everything else. And and in the course of 1 month, it goes from, they were in a middle-class life, or they were getting by. They were self-sufficient. And now everything has fallen out. And it's in those critical days, right, where it can go down two paths of, can we stop that path and that cycle before it begins, or is it 2 years later and they're interfacing with your street outreach workers and your team?
It spirals quickly. It can spiral very quickly.
And sorry, Sue, I don't mean to cut you off, but I think that's why it's so critical for anybody who thinks that they might be headed down that road, that they get in touch with it, whether it's Sue or your office or Ginny's, as quickly as possible. Because the more time that the services have to work with you, the more likely that we can make sure you don't end up in that situation where you're in a broken down car having to choose between, sleeping in a motel and purchasing food for your family. The more time we have to work with you and to work with those services, I think the more successful that we are.
Absolutely. And while you give a good example of someone that can spiral quickly into that, we also have folks who have been living rough outside, unsheltered for years,
right, whether
due to mental health issues, substance use issues, or some just choose that lifestyle. They've been living that way. That's what they want to do. They're off the grid. They want to stay there. And again, we treat everyone with dignity and respect. But also, when they're ready to make that change, how can we do that? And how can we help them move along to the next step?
So, just this past. At the time of filming, folks were always filming, several weeks before we air this show, and at this time, we're coming off the heels of just historic cold in our region. We haven't seen anything like this in really decades. Deadly and potentially fatal cold, and really saw this region step up. Fitchburg, Leominster, and Gardner alike, really each coming up with their plans of how to make sure that whether you're housing insecure or homeless or anything else in between, making sure that you had a place to go during this cold. Can you walk us through what led up to in the week before the cold? Partnering with the different nonprofit providers and different arms of government to make sure that everybody had an opportunity for shelter? It
was a busy week, that's for sure.
I can only imagine.
And we've been monitoring the temperatures always. And as we saw that...
You didn't realize you went to school for meteorology,
No.
did you?
That's the first thing I look at.
Yeah.
But as we saw that it was definitely going to be deadly, and one of the criteria that we use is someone at risk of death from being outside. We share a United Way of Central Mass emergency shelter grant with Restoration Recovery Center. Ginny's also holds one as well. So working with them, Keith and Kim were out talking to folks, making sure, do you have someone you can stay with? Are there any other alternatives?
Sure.
We identified 33 people who were absolutely in need of shelter. Starting Friday morning, we staged at Action Health Center. police department brought in some refreshments. We had donuts. We had warm coffee. People were able to stay there rather than being outside until we got them into shelter. Restoration Recovery had staff with their van. So between the van and Kim and Keith, able to transport folks over to the motel, get them checked in, which is in itself a process. And like I mentioned earlier, everyone had an ID because that's what we worked on this past summer. So that made it that much smoother so that folks could get in. We also made arrangements, the North Central Mass Faith-Based Coalition that operates out of the YMCA with meals. They delivered meals on Friday and Sunday. Salvation Army Canteen was out at the different sites over the weekend. The Fitchburg Police Department and Fire Department had their emergency shelter ready to go. People could go to the lobbies of both respective organizations if they needed help. We had one individual who refused any offer of shelter. We had wellness checks done on him. He made it through. Gave extra blankets and such, but it really was an effort of all community groups. Of everyone came together, and it worked. It was smooth, and it really went well. And I know Ginny's was able to put up some folks that were in their cars, and it was a great ending to the week of trying to plan this, but the planning and the preparation really worked, and we were happy that everyone made it through.
I was just going to say the work that you both did, and the hundreds of other individuals working in this space, across North Worcester County, to make sure that no one died. I mean, you're truly out there saving lives, and you do through your work each and every day. You don't always hear about it, and we don't always want folks to hear about it, but I know you're out there every day working hard to make sure that you can save lives and help change lives. And I continue to really beseech people to realize that homelessness can start at any level, and no one's immune from it. I, again, can't underscore, my father was homeless a decade ago. And that happened suddenly. And I was powerless to help and intervene in that situation, and were it not for some just amazing community groups and healthcare organizations that helped step up, he probably would have died out on the streets. And it can happen to anybody at any time. And don't let the stigmas get in the way, or your perceptions of what homelessness is or could be get in the way of trying to lend a helping hand and help somebody, because that's somebody's mother or father, grandmother, grandfather, son or daughter. And it's heartbreaking. But I'm inspired each and every day about the work that you do. And you might work for days, weeks, months, or years to help an individual. But I've seen that when they're ready, you've been there to change their lives, both of you. So thank you for the work that you do. And thank you for coming on to our show today.
Thanks for having me.
Thanks for having me.
Absolutely. Folks, thank you for tuning in to the Kushmerek Connection, and thank you for hearing about some amazing heroes who work in our community each and every day. We'll see you next episode.